Hello guys, as we have started our journey related to apoptosis. So when we were studying about the mechanism of apoptosis, we we told that it has a three processes and it has a three mechanism. Number one, initiative phase. Number three, number second, executive phase, and the last one that involves in the apoptosis is the removal of dead cells. All those cells that are died because of the apoptosis, they have to be removed. So apoptotic cells all apoptotic cells, they have to be removed from the body. So what will happen? Macrophage will come and it will engulf these dead cells. How macrophages know that there is apoptotic body or there is apoptotic cells? So some ligands there are some ligands present on the surface of apoptotic cells. There are some ligands present on the surface of apoptotic cells, but these ligands are not present on a normal cell. So what will happen? Macrophage will come and it will recognize that cell and lead to the engulfing of that cells. What happened to the cell? We know that the cell is apoptotic, so macrophage will come and it will engulf it. How macrophage know it? We know that there are some ligands that are present on the surface of apoptotic cells rather than normal cells. So macrophage will come and it will engulf that cells. So we take one example regarding this ligand is phospho phosphatidyl phosphatidyl serine phosphatidyl serine. This is a ligand which is normally present on inner surface of the on inner membrane of the cell. Suppose this is a cell, this is the internal membrane, it will present here. This is phosphatidyl serine. So what will happen to this phosphatidyl serine? When there is apoptosis occur inside the cell, this phosphatidyl serine, it will move from inner membrane to outer membrane. Phosphatidyl, what happened to it? It will move from the inner membrane to the outer membrane, and this process of phosphatidyl serine that comes out from the inner membrane to the outer membrane, this is called phosphatidyl serine flip. This process is called phosphatidyl serine flip. So now macrophage will come. And it will detect this cell as apoptotic cells because we have phosphatidyl serine on the surface of the cell, and macrophage will engulf this cell. This is how a macrophage detect that this is a normal cell or this is a apoptotic cells. So it is very important here. I just repeating here that here is a dye which is used, which is called annexin. You should know about it, that what is annexin. So annexin, this is a marker which is used for apoptotic cell. This is a marker which is used for apoptotic cells. What is annexin? This is basically a dye which binds with phosphatidyl serine, which this is a dye which bind with phosphatidyl, which bind with phosphatidyl serine. So all apoptotic cell can be identified because they have phosphatidyl serine on the surface. We already told that phosphatidyl serine will come out from the inner membrane to the outer membrane. So when we use annexin in order to find the whether the cells is apoptotic or not, so on all those cells which has a phosphatidyl serine on the surface will be considered as apoptotic cell. So annexin is one of those marker which is used in order to find whether the cell is apoptotic or not. In other markers that are used, we can also say that the protein complement protein like C1 cave, what happened to it, this is also over expressed, this is also over expressed in apoptotic cells, which make it much more edible for macrophages, much more edible for macrophages. So these two are the markers which are used for the in order to find out the apoptotic cells are normal cells. So the process of phagocytosis, the process of phagocytosis of apoptotic cell, process of apoptotic cell, this is called apro this is called apoptosis. The process by which the apoptotic cell is phagocytosed by macrophages, this is called apoptosis. So this is all about the removal of the dead cells, that when apoptosis occur inside the cells, the cell become died, and how the dead cells are removed from the body. Now as we have discussed necrosis, we also discuss apoptosis. So now we will find out a little bit differences between necrosis and apoptosis. Differences between necrosis and apoptosis. So number 1, necrosis is enzymatic. Necrosis is enzymatic or ischemic process. This is enzymatic or ischemic process. Apoptosis is genetically programmed cell death. It is genetically programmed cell death. Number 2 is that in necrosis there is a group of cells which are to be dead. Group of cell death occur inside the necrosis, whereas in apoptosis here occur single cell death. So in necrosis the plasma membrane is damaged. Here in apoptosis the plasma membrane is intact. It is intact. Inflammation is present in necrosis. Inflammation is absent in apoptosis. For necrosis we have no marker to find out whether the cell is necrotic or it is a normal cells. But for apoptosis we have a marker like annexin, CD95, which are used to find whether the cell is normal or whether the cell is apoptotic cells. So in DNA electrophoresis, how a necrotic cell look like? It show a smear pattern. In electrophoresis. How a smear pattern look like? Suppose this is, it will like This is a smear pattern. While in DNA electrophoresis in apoptotic cell, it shows steep ladder pattern. Steep ladder pattern. How it look like suppose this is electrophoresis, it will look like it. So this is all about the differences in the necrosis and apoptosis. If you are new on our channel, subscribe our channel.